afternoon, Ms. Bennett.
Good afternoon, Ms. Reyes.
My name is Nicole Reyes, and I'm the nurse practitioner today. Why are you coming to visit me today?
Because I'm having problem when I urinate, it's burning me.
Okay. Is this only when you urinate?
Yes, ma'am.
Okay. On a scale of 0 to 10, how bad is the burning sensation?
9.
So it's painful. It's about a 9 out of 10? Okay.
Yeah.
How often do you go to the bathroom a day?
Very often.
Very often? Okay.
Yeah.
Do you wake up at night to use the bathroom?
Yes, ma'am.
You do? Okay. Do you notice any bleeding with urination?
No, ma'am.
No?
Just the
Okay.
burning.
Do you have any back pain with urination?
Just a little.
Just a little bit?
Yes.
Okay. Do you, is it mostly in your stomach though, or mostly in your
In my
back?
stomach.
In your stomach?
Yes,
Okay.
ma'am.
Have you ever had kidney stones?
No, ma'am.
No? Okay. Are you incontinent? Do you sometimes
No, ma'am.
not go? No? Okay. Okay. What have you been doing to relieve the pain? Have you been taking any medication for it, or no? And does anything relieve the pain?
No, that's why I come to you, ma'am.
Okay. Okay. Are you on any medications
No.
for anything else? No? Okay. As far as health history, do you have any diabetes or high blood pressure?
No, ma'am.
Do you have any history of seizures or anything else?
No, ma'am.
No? Okay. As far as any childhood illnesses such as asthma or mono, have you had any of that?
No, ma'am.
No? Okay. As far as immunizations, have you had a flu vaccine recently?
No.
No. Have you had the HPV vaccine?
Yes.
Yes. When was this?
About 3 years ago.
Okay. Okay. Do you have any allergies to anything?
No.
No. Okay. Have you ever been hospitalized for any procedure or surgery?
No, just having my children.
Okay. How many children do you have?
3.
Okay. Okay. Are you married, single?
Married.
You're married? Okay. Tell me a little bit about what you do and where you live.
Well, I'm a nursing assistant. I work in a nursing hospital home. I live in the Bronx.
Okay. Do you live in an apartment building
I
or
live in a
house?
private house.
Oh, in a private house. Okay,
Yes,
good. Okay. Do you smoke any cigarettes or drink alcohol?
I don't smoke. I'll have a glass of wine now and then.
Okay. Okay. As far as being active, do you consider yourself active?
Yes, sir.
Yeah.
Yes.
Okay. I noticed you said you were married. I just have to ask you, as part of sexual history, are you in a monogamous marriage with just one partner?
Yeah, just my husband.
Okay, okay. And as far as religious or cultural considerations, do you have any regarding medical care?
No.
No? Okay. Okay. Just going to ask you a little bit about family history.
Okay.
Anything that comes to mind as far as your mother and your dad, any history of hypertension or diabetes or renal failure?
My dad was diabetic,
Okay.
but he passed now.
Okay.
My mom, no. She's not diabetic.
Okay. And she's alive and well?
She's alive.
Okay.
Yes.
How old is she?
My mom is 72.
Okay. And how old was your dad when he passed?
My dad passed when he was in his 60s.
Okay. Okay. And as far as your siblings, do you have any sisters or brothers?
Yeah, I have 3 brothers and 4 sisters.
Okay. And are they alive and well?
Yeah, they're all alive.
Okay.
And
Any illnesses or?
one of my sister, when she was pregnant, she was borderline diabetic.
Okay.
But after the pregnancy, she's okay.
Okay. Okay. Okay. So just gonna ask you some more questions. just going by systems, as far as your head, do you have any headaches or migraines?
Well, when you say headache, every now and then, but nothing serious.
Okay, okay. And as far as eyes, I notice you wear glasses.
Just for reading.
Oh, just for reading?
Yes.
Okay. Okay. Do you have contacts as well, or just the glasses?
Just the glasses.
Okay. And your ears, how's your hearing?
Very good.
Okay.
I hope.
As far as your nose, do you ever have any nosebleeds?
No.
No. Any problems breathing through your nose?
No.
No. Okay. Your throat, have you ever had your tonsils removed or
Not that I know.
No. Okay. Okay. Just want to ask you if you perform self-breast exams in the shower or anywhere.
Yes, I do, and I also go for my mammogram.
Oh, okay, good. When was your last mammogram?
Last year, I'm due now, anytime now, so.
Okay, so you have to
Yes.
follow up with that, right?
Yes, ma'am.
Okay. As far as respiratory conditions, I know you said you don't have asthma or mono and you haven't had a history of that. Any history of pneumonia or TB?
No, thank God for that.
Okay. Any exposure to TB?
I don't think so.
Okay, okay. Any pulmonary emboli, anything like that?
No.
No? Okay. As far as heart, any heart conditions?
No.
No. And you already told me no high blood pressure, no murmurs, no palpitations. Okay. And no problem breathing during the day or night, right? Okay. How are your legs and your arms? Have you noticed any extra swelling in your calves or legs or feet?
No, only when I'm on my foot long, like when I work 4 days or 5 and I'm on my feet, my ankle just swell up a little bit.
Okay.
But I just elevate it and
Oh, you elevate it when you come home?
when I come home.
Okay, okay. Do you have any varicose veins?
Yeah, but I have those from young age.
Okay, okay. Okay, so nothing new, right?
Nothing new.
Okay. And any leg cramps?
No.
No? Okay. Alright. And no history of aneurysms, right?
No, ma'am.
Okay. Just moving along, do you ever have trouble swallowing or heartburn? Have you noticed a change in appetite?
No, I
No.
eat same way.
Okay. Any nausea?
No.
No? Okay. And as far as your bowel movements, would you say you go pretty regular?
Yeah, regular.
Yeah.
Yeah.
And for regular for you is about how many times a week?
Twice a day.
Twice a
Morning
day.
and evening.
Okay, and that's always been?
Always.
Okay. Any pain with that?
No.
No. Any bleeding with that?
No.
No. Any constipation or diarrhea or hemorrhoids?
Only like sometimes when I eat something that doesn't agree with me, I may have loose stool.
Right.
That's
Okay.
it. Just
Okay.
one time and that's it, man.
Right, but nothing out of...
No.
Okay, no issues with that. Any excessive belching or passing of gas? No, okay. Any jaundice, liver, or gallbladder issues or trouble?
No, man.
No, okay. And any history of hepatitis?
No, man.
Okay. All right. And then just to kind of go into a little bit depth, has this been the first time that you've experienced burning with urination?
Yes, ma'am.
Yeah, okay. All right. And have you had any history of cystitis?
What is that, ma'am?
It's like inflammation of your cysts. Any ovary problems?
Oh,
any
no, ma'am.
genital?
No, ma'am.
Okay. Any STDs?
No.
No. Okay. Are you still menstruating?
Yes, ma'am.
Okay.
But not regular now.
Okay.
And irregular.
It's a bit irregular now?
Yes, ma'am.
Okay. Alright. How long has it been a little irregular?
For the past year, from last year, July.
Okay.
Yeah.
Okay. Any so it's do you have like bleeding in between periods or no? Okay. Okay. So you said you've had three children, right?
Yes, ma'am.
Okay. Any history of miscarriages?
No, ma'am.
No? Okay. All right.
And I have an adopted one.
Oh, you do?
Yes, ma'am.
Okay.
Yes, ma'am.
So that's 4.
Yes, ma'am. 4 of them.
Okay.
Two girls, 2 boys.
Okay. As far as neuromuscular, do you experience any joint pain or muscle stiffness?
No, ma'am.
No? Okay. Do you tend to have any backaches?
Sometime, what I know is when I'm tired.
Right.
When I'm
Okay.
tired.
Okay. No arthritis, no history of seizures?
No, ma'am.
No. Any history of stroke or memory changes?
No.
No. Any dizziness?
No, ma'am.
No. Okay. All right. And then as far as you seem like a very happy, very happy woman. Any history of depression or anxiety?
No.
No. Okay. Any suicidal ideations?
No.
No. Okay. All right. So moving along. Any blood or clotting disorders?
Apart from when I see my menstrual acid.
Oh, that's it.
Yes.
Okay. No anemia.
No. I know when I was younger, they said I was anemic,
Okay.
but it just disappeared.
Okay.
You know. So
Okay. Around what age was that?
when I was 20,
Okay.
21, 22, before I had my first child,
Okay.
yes, I was anemic,
Okay.
but it just went away.
And then, okay, so you haven't had any issues with that?
No.
Okay. Any history of gout or lupus
No.
or rheumatic arthritis?
No, ma'am.
No. Okay. All right. And then you already told me no diabetes. Any history of thyroid disease?
No.
No.
That I know of.
Okay. Have you experienced any excessive sweating or thirst or hunger? Those are kind of some of the symptoms of it?
No.
Okay. All right. Have you noticed any new rashes on your body or any itchiness?
No, ma'am.
No? Okay. All right then, so I'm going to do the physical exam on you and review the assessment, but what I think you have is a urinary tract infection.
Yes, ma'am.
So we'll get a urine culture and prescribe you some antibiotics and something for the pain, okay?
Okay, ma'am.
Okay.
Thank you very much.
You're welcome.